I'm Ashley, and I'm going to do the abdominal assessment and the musculoskeletal and neurological assessment. I would start out with my patient. I've already done the heart sounds, and the kidneys, and now I would assess by observing first inspection. Make sure that there's no veins sticking, no veins pulsating, no masses, no lumps, no hernia, anything protruding out. I don't have my stethoscope, so we're just going with it. I would then use the diaphragm and listen to the bowel sounds, and I would do that in this the bottom quadrant, lower quadrant, and then up and over and down. Then I would flip it over and use the bell of my stethoscope, and I would listen to the arteries, and I would start here with the aortic artery, then do the renal, the iliac, and the femoral. Then I would move to the other side and come back up. Then I would percuss, and I would do that, and I'm listening for tympani. I want to kind of hear a hollow sound. I don't want to hear any thuds or anything that might sound like a mass. I would also percuss the liver, and I would do that by coming to the umbilicus midclavicular and going up until I hear a different sound, and then start here till I hear a different sound, and then I would mark. I would also do palpate, and I would palpate circular motions, not too deep. Of course, if the patient has any pain, we would stop and inspect that more. Then I would do a deeper palpation. No pain? Okay. I would also palpate the liver, and take a deep breath for me. Okay. And I would do the same with the spleen. I don't want to feel the spleen. Feeling the spleen would mean that there's an abnormality, and I would need to contact my provider. I would also try to percuss the spleen. Let me see that. And I might be able to hear it. It's kind of hard to hear sometimes. I would do, I would check for radiating pain by pushing down. Does it hurt here or anywhere else? No? Okay, I would also push down and release to see if it hurts when all the organs move back. So does it hurt when I push down or when I push up? No. Or lift up? No. I would put my hand here and press and try to tighten up your muscles to see if there's any pain. I would here, and can you take a deep breath for me? Okay, she can take a deep breath, so that's an indicator that there's no gallstones. Can you lift your leg? Just lift it up. I would say that there's no appendicitis, and that would complete the abdominal assessment. Next would be the musculoskeletal, and with that I would inspect the extremities to see that they're similar. I would make sure that the hair growth and distribution was the same, that there's no rashes, pigmentations, anything like that. I would check range of motion, and by doing that, can you lift your leg up? Okay. Can you lift this leg up? Can you bend your knee to you? Okay. What about this one? Okay. Can you push the bottom of my hand? Can you push up? Okay. Can you push? Okay. I'm also checking muscle strength as I'm looking at the range of motion. Can you push up on my hand? Okay. Push down. Push up. And push down. Okay. I would also look at the adduction. Also, can you move your leg this way for me? Okay. What about this leg? Okay. Can you sit up? You can sit right here. I would also check range of motion in the upper extremities as well. So, can you arms out? Can you put your arms behind your back? Put your shoulders. Okay. Let me see your hands. Can you squeeze my hands? Okay. Can you push in? Pull in like this. Okay, push out. Okay. Pull back. Can you push backwards? There we go. Push forwards. Okay. Can you raise your arm? Okay. I would also do a scoliosis test. So I would have her stand up. Okay. Get together and bend forward. And I would check that her spine is straight. I would also be looking, stand up for me. I'd also be looking to see that her shoulders are equal. One's not higher or lower than the other. While I have her here, can you do, right here for me. Can you stand on your heels? Stand on your heels? Can you stand on your toes? Can you, whoa, okay. Can you squat? Okay. I'm also doing a neurological check while I have her standing here. Can you stand feet together, arms by your side, eyes closed? Okay. And I would wait about 20 seconds. This is to see that her equilibrium is okay and she's not off balance. Okay, you're good. You're good. Have a seat for me on the bed. I would check her reflexes in her knees. Okay. And I would check her cranial nerve for smiles. Especially with older patients, you want to make sure that that there's facial symmetry, so that you could catch any indication of a possible stroke. So could you look at me? Can you smile? Frown? Blow your breath out. There we go. Can you stick your tongue out? Okay. And I would note any abnormalities. Of course, if the tongue deviates to the side or if the smile is drooped, then I would contact the provider immediately. And that does my assessment.